Let's welcome on board Alisha Moopen, Deputy MD, Aster DM Healthcare, and let's talk about this CCI nod that they've got for Aster DM and Quality Care merger. Alisha, hi, morning, good to have you on the show. Tell me, now that you've received the CCI approval, what's going to be the timeline for this completion of the merger, and when is it that we should expect the synergies to actually trickle in?
Thank you, Aisha. Really nice to be here. Yeah, we're really happy with this milestone with the CCI approval. I think we filed for it end of November, so a very healthy timeline to get the CCI approval. We're hoping that now with the NCLT approval, that will come through by Q4 of this year. When you're talking about the synergies of the merger, of course, you understand this is a very large-scale merger. It's the biggest one in healthcare. We're talking about a very large platform, more than 10,000 beds. We have more than 5,000 doctors coming together. So we want to start working on the synergies, largely on the procurement, the inventory, working capital with insurance companies. So we are hoping that beginning of FY27, you will start seeing sort of the benefits on the synergies of and the economies of scale starting to coming in.
Complementary areas where you think the synergy benefits would kick in, can you specify?
Yeah, it will largely be around procurement, Nikunj, right? Because at the end of the day, the scale of this merger, when you're looking at even capital equipment, right? When we're buying ultrasounds, robots, different machines, whether it's, the main medical equipments, materials in terms of gloves, syringes, consumables, when you're talking about medicines, looking at the formulary together. So at the end of the day, what we see is that we should be able to have a much healthier material cost. Maybe that will take around 12 to 24 months for all the benefits of the merger to come together. But there are some which are easy wins, especially when we are opening new hospitals and you're investing in capital equipment. And these are, we've got around 3,000 beds that as a combined merger, we're talking about adding in the next 2 to 3 years. So that's almost 3,000 crores of investments. So for that, when you look at even just in the immediate sense, we should be able to see some of the benefits as we start negotiating with our vendors.
Good morning. This is Shrishti also joining in. But in terms of the geographical presence, Alisha, what we see is that 50 to 60% of the revenues come in from the Kerala market. And given the competitive intensity that is seen to be increasing, help us understand how do you see this market growing and your revenue contribution moving in the times ahead?
So thank you. Great question, actually. So we definitely started, at least as Aster, from Kerala. We do have a very strong market presence in Kerala, largely has been in North Kerala and then in Central Kerala with Kochi having Aster MedCity. Now with this merger, we also include the KIMS brand comes in, which actually covers the south of Kerala for us. So yes, you're right. In the merged entity, probably our combined EBITDA will be close to sort of 50%. But what's great about the merger is also opening a whole lot of new markets for us in central India, right? We'll now have presence in Bhubaneswar, Aurangabad, Raipur. So the focus is that we'll, of course, consolidate in Kerala. You're right, there is a lot more competition coming in, but we do have a market leadership there. When you talk about, especially on the clinician side, from a consumer, from a brand affinity perspective, we really are loved and adored in Kerala, and we this will at least make us even more competitive, and we hope that it will be good for the market as a whole. But there is a huge focus on also building up the other parts of the scale. We would like to, in the next 2-3 years, look at a pan-India presence. So the idea is to sort of diversify further. The merger itself gives us that diversification. We were in 15 cities. We'll now be in 28 cities. But how do we sort of have more than just the South and Central India? Start looking at different parts and get that coverage. And that's really kind of one of the key goals of the merger, and to create that scale to become a pan-India player, to be honest.
Is the hospitality or the entire healthcare sector going through what could be called as binge expansion. Everyone is expanding. Everywhere I can see consolidation happening. Big chains are going, regional chains are going global. Global chains are coming to India. I mean, just too many beds are getting added up, isn't it true?
It is true, Nikunj, but the reality is we still need so many beds, right? So when you look at a very high macro level, when you're looking at India's beds, we're still talking about 1.5 beds to, 10,000 population, and it's still far away from where we need to be at a WHO recommendation of 3 beds. So I think you're right. I think what's good is that there is a lot more corporate hospitals that are coming up. The big chains are getting bigger. And then there is more standardization of protocols happening. The outcomes for the patients will be better with this. So I think, you're filling a need in the market where there is a gap. So seems like that makes sense for investors. Definitely a lot of sense for the customers. And at the end, the patient and the nation benefits.
What are you doing to ensure that the moat what Aster DM has, that is going to be expanding? I mean, you have a moat, you have a bankable healthcare system, but what are you doing that it just expands?
Yeah, so Nikunj, honestly, I think the most important thing in healthcare at the end of the day is going to be your clinical excellence. So for us, this combination of 5,000 doctors coming together, it's really on building that clinical capabilities. We're talking about huge advances that are happening in science and technology. And if we have the scale, it helps us sort of adopt technologies faster. We're able to invest in better equipment, and we're able to kind of form sort of clinical goals, clinical programs, whether it is in oncology, whether it's in cardiovascular diseases, whether it's in neurosciences, transplants, some of the key requirements, the key strengths that we have as a group, the combined strength between Care and Aster, we said, how do we double down on this? There are 2-3 departments which we have a huge amount of moat, as you exactly called it. And how do we sort of strengthen that further by combining forces? So for us, when we look at clinical outcomes, when we look at patient service, patient experience, we think that there is a lot of benefits that's going to accrue. Another thing that's really important is the experience for the patient now, right? So I think post-COVID, one of the key trends that you see are people are taking insurance. People have choices. Do they want to go to, provider A or provider B? So we are actually investing a whole lot on digital as well, so that when it comes to the customer and the patient experience, it is more seamless. So the combination of having that clinical excellence and that service excellence is really what's going to set people apart. Set a provider apart. So that's the goal.
So good having you on the show. Thanks so much for your time today.